This is a 24/7nursetutors.com lecture. 24/7 Nurse Tutors, providing unlimited tutoring.
Welcome, and thank you for joining us. Test Taking Skills and Strategies Workshop, Part 3.
Class, I'm going to teach you how to respond to psych questions. But before I do that, I want to take a second to get on my soapbox and tell you why I love nursing. In nursing, you can do anything you have ever wanted to do. We span almost every career in the world. Just name it. You do not have to be a bedside nurse. Just look at what you can do once you become a nurse. At the chief level, we have CNO, a Chief Nursing Officer, and CEOs. In the oil industry and engineering, we have occupational health nurses. In clinics, we have nurse practitioners. In surgery, we have CRNAS. In academia, we have educators and teachers like myself. In research, we have research nurses. In social services, we have case managers. In elementary and secondary schools, we have school nurses. In information technology, we have nursing informatics specialists and clinical specialists. In sales, we have medical sales reps. In the insurance industry, we have review nurses who work from home. How about the lawyers, the legal field? We have legal nurse consultants. Management, we are in management throughout the hospitals and beyond. Who runs the units and departments? Pick 10 units in the hospital. Who are the managers and directors? Nurses. Do you want to fly around the world? Become a concierge nurse. Want to work in public health and visit people? Work as a public health nurse. Want to fly across the country? Join us and teach live NCLEX reviews. Can you name just one area or field in which you will not find a nurse? And did I mention we have so many jobs? The U.S. had to beg other countries for nurses. Yes, look at the news and papers and check some unbelievable sign-on bonuses for nurses. $10,000 golden handshakes? Just say yes. Did you know year after year we are consistently ranked as the most honest and ethical profession in the United States? You have chosen the best profession in the world. And I'm sure you can see I'm a bit biased. Now that I have that off my chest and I'm off my soapbox, are you ready to learn how to answer some questions? Okay, we just learned some new things, so let's practice by answering some questions. We saw this question in part 1, and we used the stat word method to get the correct answer. Class, did you know with many NCLEX questions there are 2 ways to choose the right answer? Yes, it's true. So I'm going to teach you a second way to answer this question. Remember in part 1, I told you we could use Maslow's to answer psych questions? Let's learn how. Maslow's hierarchy of needs is a theory that proposes the things humans require, such as food, water, safety, community, and esteem. There are 5 stages: physiological, security, social and esteem needs, and self needs. I want to teach you how we at 247nursetutors.com would like you to answer psych questions. Here is what I want you to write in your book. Physiological need. Beside this answer, I want you to write your ABCs. And second, I want you to write pain unrelieved by pain medications. I did not say any pain because you know pain does not kill, but pain unrelieved by pain medication is so serious I can keep it up here beside my ABCs. Number 2, safety. Your patient's safety is the second most important answer. 3, comfort or pain. Beside comfort, please write pain. 4th, I want you to write down psychological. 5th, social. And 6, spiritual. Let's look at the question again. The nurse is caring for a client who was admitted on an involuntary basis to the psychiatric unit. Which action by the nurse is the highest priority? A. Reassuring the client that he knows he has the best nurse in the hospital. B. Ask the client the reason for their admission. C. Offer the client's spouse the opportunity to share their concerns about the client's admission. And D. Advise the family about the legal rights of the client. A. Reassuring the client that he knows he has the best nurse in the hospital. Reassure the client. What does that sound like? Could this be meeting a physiological need, a safety need, a comfort or pain need? Is this psychological, social, or spiritual? Reassure the client. I think it would be a psychological need. Psychological needs is number 4 on the list I gave you. Write number 4 beside this answer choice. B. Ask the client the reason for their admission. What does this sound like? Could this be meeting a physiological need, a safety need, a comfort or pain need? Is this physiological, social, or spiritual? I think it would be a safety need. Safety is number 2 on the list I just gave you. Please write number 2 beside this answer choice. C. Offer the client's spouse the opportunity to share their concerns about the client's admission. Share their concerns. What does that sound like? Could this be meeting a physiological need? No. A safety need? No. A comfort or pain need? No. What about a psychological, social, or spiritual need? I think this would be a psychological need. Psychological need is number 4 on the list I gave you. Write number 4 beside this answer choice. D. Advise the family about the legal rights of the client. Advise the family about legal rights. Could this be meeting a physiological need? No. A safety need? No. A comfort or pain need? Not really. Is this psychological, social, or spiritual? I think it would be psychological. Psychological need is number 4 on the list I gave you. Write number 4 beside this answer choice. Let's look at what we have written down beside each answer choice. A. Reassuring the client that he knows he has the best nurse in the hospital. We wrote number 4, psychological. B. Ask the client the reason for their admission. We put number 2, safety. C. Offer the client's spouse the opportunity to share their concerns about the client's admission. We put number 4, psychological. D. Advise the family about the legal rights of the client. Once again, we put number 4, psychological. The numbers alone have given you the answer. Number 2, safety, is higher up on Maslow's than any other answer. This is the second time our test-taking tip has picked the same answer. Let's discuss some important test-taking tips. Remember, all your NCLEX questions are based on a perfect world. So how many patients do you have? 1. Remember, NCLEX is the perfect hospital, and you only have 1 patient. What about equipment and supplies? Do I have enough? Yes, you do, and everything is right there for you to take and use. Don't rely on your previous experiences you have had working as a healthcare professional, what others have done, your personal experiences, or what you believe to be true. Important information regarding test-taking techniques is used here. They are for standardized exams only. Because NCLEX is the ideal hospital, things are pretty straightforward. What we do in clinical is different. We don't go to a practical nurse and say, hey, you take the stable clients in room 1, 5, room 10, and room 23. In real life, we say, hey, you have rooms 1 to 5, I'll take 6 to 10. Class on NCLEX, who gets stable clients? Well, a graduate nurse. A graduate nurse has to have a stable client. In some states, the Board of Nursing will give you a temporary graduate nurse license before you can even take the NCLEX. So you can actually work as a nurse on the floor and get paid as one. However, it does not last long, and you are expected to take the NCLEX as soon as possible. If you have a graduate nurse on your team, he or she will get a stable client. A brand new nurse is someone who has just passed the NCLEX, and they too will get a stable client. What about a floating nurse? Class, I don't care if the nurse has 50 years experience in a different unit. The nurse is floating and must get a stable client. Your LPN or LVN gets stable client. And for our unlicensed assistant personnel, they too get stable clients. Well, I'm sorry to inform you I only have time for one more question. Let's do it together, shall we? The nurse is caring for a 3-month-old who has CHF and notes that the infant was given a scheduled dose of Lanoxin with a documented apical pulse of 89 beats per minute. What action should the nurse take first? A. Obtain the lab results and check the serum potassium level. B. Observe the EKG for the onset of arrhythmias. C. Complete an adverse occurrence report. Or D. Assess the current apical heart rate. Let me tell you a story about what happened to me in the hospital where I worked as an administrator. Have you ever been to a Code Blue? Yeah? How many people are in the room? Yeah, a lot. In the hospital I worked, management had to attend Code Blues. So I'm sitting in my office and I hear, Code Blue room 5, Code Blue room 5. It was my turn this week to attend Code Blues. So did I run or did I walk? Well, of course I ran. So I go running as fast as I can to room 5. When I get there, I find the client in room 5 sitting up in bed, bewildered while there were so many people in his room. What happened? I'll tell you what happened. The new graduate nurse was sitting at the nurse's station and looked up to find the EKG rhythm shown in your video. She noticed the EKG room 5 showed a flat line. She must have said, my client is dead. Knowing what that meant, she quickly called a Code Blue. Class, what's the first thing she should have done? Yeah, she should have gone and checked on the client. His leads may have been disconnected. Class, who told her the client was dead? A machine. Class, anytime. Yes, I used an absolute word. Anytime you receive secondhand information, there is only one answer choice. Assess your client. Whether it is in real life or on the NCLEX, verify the information as soon as possible. Go to your client. Make sure it agrees with what the secondhand information is telling you. Where can we get secondhand information from? Well, we can get secondhand information from documents like a chart or a computer. You can get it from an equipment like an EKG, a pulse ox, or even a blood pressure machine. Can people give you secondhand information? Oh, yes, they can. An unlicensed assistive personnel, housekeeping, family members, a pharmacy tech. Regardless of who gives you the information, assess your client. However, if you did the assessment and this client is in distress, do not assess. Choose an action, please. Now we have learned an important test-taking strategy. Let's look at that question again. Before we begin, at the top of the page, please write bonus question in capital letters. The nurse is caring for a 3-month-old who has CHF and notes that the infant was given a scheduled dose of Lanoxin with a documented apical pulse of 89 beats per minute. What action should the nurse take first? Obtain the lab results and check the serum potassium level. Observe the EKG for the onset of arrhythmias. Complete an adverse occurrence report, or assess the current apical heart rate. Class, you don't have to think very much because it's a bonus question. A bonus question should take us about 15 seconds or less. I have one question. Who told you the apical pulse is 89 beats per minute? Read the scenario again. A document told you the apical pulse is 89 beats per minute. Is that secondhand information? Yes. Then there's only one answer choice. Assess. Assess the current apical heart rate. Remember, you are more than a conqueror and you will be successful. Join me as we review core content in the next unit.